today for this. Thank you for joining us today for this session that will provide a brief overview of our health literacy grant opportunity that is generously made available through the support of the Florida Blue Foundation. So thank you, Florida Blue Foundation. They've been supporting this effort since 2009. So it's been a long-term commitment. We've had lots of good results. And again, we appreciate your interest in potentially joining the group or continuing to be part of this effort for those of you who are considering returning as grantees. So with that, I just want to introduce myself. I'm Greg Smith, Executive Director of the Florida Literacy Coalition. I'm joined today by my colleague, Dana Williams, our ESOL program coordinator, who's helping with this grant application this year. And I'm going to go ahead and pull up the PowerPoint slides here. Okay, here we go. Folks see that, I hope? Yes, okay, see thumbs up there. Okay, great. Okay. Okay, so health literacy. We go with the definition that is commonly used through the National Center for Education Statistics, that health literacy is defined as the degree to which individuals have capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. There are different contexts in which that plays out. We've kind of divided them into three different areas. Clinical areas here, where folks are looking to understand personal information related to their health. That can be reading instructions, filling out forms, getting information they need to make good healthcare decisions with regard to any kind of medical circumstances they may have. The second area is focused on prevention and making healthy lifestyle choices to maintain your health and the health of your families. The third area is navigating the healthcare system, which can be quite complex for a lot of folks, especially people who are from other countries and may not be familiar with how our healthcare system works here in the United States, or also people born and raised here who just haven't had to interact with the healthcare system very often. So laying the groundwork. Of course, we can't get into a lot of detail, but basically looking at some of the overarching, providing overarching information in terms of our healthcare system, how to access the healthcare system, what are some of the options, how do you pay for it, and that's where we talk a little bit about insurance and so forth. So these are the kinds of areas that we touch on in this in our project. This is a quote that we like to share. Nothing, not age, income, employment status, education level, or racial ethnic group affects health status more than health literacy. That's from the National Patient Safety Foundation. This is some older statistics. Unfortunately, we don't have anything more recent that really did a deep dive on health literacy and adult basic education and literacy, or folks who lack literacy skills. But this was through the National Assessment for Adult Literacy, and they did a special, had a special focus in their research on this topic, and they showed that that there was a really strong correlation between folks who have below basic health literacy skills and in other populations. And if you look at this group of other population, a lot of them are many of the students that we tend to serve in adult education, folks who have not completed high school, folks who have limited English proficiency, minorities, older folks, people who are not insured. So I think this really reinforces what we've found to be the case through the years we've been doing this, that this is a really good fit for adult education programs and students to really kind of take a contextualized approach to instruction, where they're really gaining valuable information that they can use in their daily lives. People with poor health literacy are more likely to have chronic diseases, less likely to get the health care that they need, have an average of 3 times as many prescriptions filled as those with higher literacy, are twice as likely to be hospitalized as those with higher levels of literacy. And unfortunately, there's been some research that shows that there's a direct correlation to life expectancy as well. So to talk about, so that lays the groundwork as to the why. We feel this is a really good fit for students to really gain information as they're building their skills. So let me talk to you a little bit now about the initiative itself. And I know some of you are already familiar with this. This is something that, as I mentioned earlier, we've been doing since 2009 through the support of the Florida Blue Foundation. This is meant to be an integrated model, really focused on adult education literacy and family literacy. So providing training and resources and funding assistance as part of this. So we do provide the grants, but we also try to support local programs in other ways, providing professional development and instructional resources and opportunities for grantees and others to engage in dialogue and conversation about this. We have a track at the Florida Literacy Conference that focuses on health literacy. So we try to be supportive in a variety of ways to help share information that could be useful to programs and create opportunities for programs to share information with each other. We've awarded 75 organizations, over 75 organizations with grants up to this point. We've served more than 26,000 collectively. The we being all of our grant recipients have served more than 26,000 students through this initiative. And partnerships are a big part of this. And we've been able to document 390 community partnerships. There's probably more than that, but lots of partnerships to put these programs in place at the local level. Here are our 2024 Health Literacy Grant Initiative grantees. So we do have a nice cross-section of programs here, geographically, as well as sort of the kinds of organizations. And we do welcome organizations to reapply for grants. So a number of these folks are returning grantees. Here's a little bit on some of the statistics. I'm not going to do a real deep dive, but just sort of a few statistics I wanted to share with regard to progress. We do ask that programs administer a pre and post health literacy assessment so we can get a sense as to the progress that's made. Here, 68% of students tested improved their health literacy with an average increase of 22%. Probably more importantly, in many respects, is what are they doing with the information? Is this something they're putting into practice? And we do consistently get good feedback and good data on the fact that students are exercising. Many students are exercising more, eating healthier, learning to do things such as reading medicine labels and just sort of applying what they've learned in a very practical ways when it comes to sort of their health and their ability to sort of navigate the system and communicate better with their doctors or other healthcare professionals. Health literacy, family health literacy is a motivating factor. So some of the programs are family literacy programs that involve adults and children. But we feel that all the programs certainly can be helpful to families, as many students can take this content and apply it in their daily lives for literacy and ESOL instruction, really helping to motivate learning through the acquisition of information and literacy skills. And there's some good stuff out there, resources. We have some materials, and there's other materials too that really, you don't have to start from square one on this. There's a lot of good stuff that's already in place. And here's a few photos of some of the projects and activities that some of the programs have engaged in. Contextualized instruction, is at the heart of this. This slide just sort of speaks to how that can play out. So infusing health literacy into adult education ESOL curriculum can enhance student understanding in many different areas, including English language skills acquisition, literacy acquisition, conversation skills, numeracy. Digital literacy is really important. Helping to build confidence, critical thinking, and of course, providing valuable health information. Part of what we do and what are sort of expected of the programs to do is to engage, or we certainly encourage them to engage in community partnerships. And there's really some interesting ways that that's done. People coming in and doing presentations, going out and doing field trips, sometimes accessing services, getting eyeglasses, doing CPR classes. There's lots of different ways that this sort of manifests itself. Part of what also is expected is to do some sort of project-based learning activity. And we will send you the, in fact, Dana, would you mind just putting this presentation into the chat? Would that be workable? Just save this as a PDF and put it into the chat. Okay, I appreciate that. So we can send these to you afterwards as well, but we can go ahead and put this into the chat. And all these where we have underlying items here are links. So you can go through this presentation and click on some of these areas, because there's really some good examples of project-based learning that a lot of our programs have already engaged in. We also, as I mentioned, try to provide some resources. So Staying Healthy, some of you may be familiar with our Staying Healthy series of books, and these are made freely available to grantees and to others in adult ed through our clearinghouse. We have our Staying Healthy for Beginners and our Staying Healthy Blue Book, which is a little bit higher level. That's our original text. All these are available on our website to take a look. We would ask you to please look at them prior to ordering them, but most of the grantees, high majority of the grantees utilize these texts, and it does kind of help to keep everybody on the same page with regard to sort of the topics and aligning those topics with some of the questions that are asked in the pre and post assessments. These are all sort of core fundamental things. These are written at for adult literacy and ESOL students. There's also a lot of other good information out there. We've developed some stuff over time, videos and other corresponding documents or corresponding resources that go along with our Staying Healthy series. But there's also lots of other good stuff out there. We did a couple years ago EdTech Makerspace, where practitioners came together and developed resources or basically collected a lot of resources and put them into a very readable and understandable format. So you can click on these here and go to our interactive library that was developed through that EdTech Makerspace project that we had. We also have some instructor webinars on our website, and our conference, a little shout out for our conference, which is coming up May 13th through 15th in Daytona Beach. As I mentioned, we're going to have a health literacy track, but there's going to be lots of other offerings there too. So we'd love to see you come out and join us for that. In addition to the sort of Staying Healthy guides here, let me do a quick mention of our careers in health too. So that's another area that's really can be of high interest to folks. There's lots of career opportunities in health, and this kind of provides a very plain language approach to taken a look at what some of those options might be that require 2 years of or less of post-secondary education. So the grants. So the grants are $5,000, up to $5,000. They're mini grants. We will be awarding 14 likely, or up to 14 grants this year. In terms of requirements, this is for either nonprofit or government-based programs. So you can see the requirements there, providing adult education literacy, family literacy services, can be small groups, can be one-to-one tutoring, committing to the sort of basic reporting requirements, and attending 4 grantee meetings. So we have quarterly meetings where the grantees come together via Zoom and share what they're doing. And we typically have a presentation, a PD presentation as part of that as well. It's a great networking opportunity. With regard to family literacy, just wanted to share, and this is in the guidelines, what we recognize as family literacy. And that's a term that can be broadly used in a lot of different contexts. But for the purposes of this, it would need to be a program that has some sort of adult education, ESOL, basic education type component to it. A children's component as well, and they typically will have shared parent-child activities too. So it really isn't a good fit for programs that are sort of more reading enrichment programs for children, things of that nature. There needs to be a pretty solid adult caregiver or parent component to it. So our deadline is coming up on the 20th, and I'm going to turn it over at this point to Dana, who's going to do a little walkthrough on the actual application. So Dana?
Thank you. Yes, so let me go ahead and share with you all of these documents. Our application, guidelines, checklist, and FAQ are on our website.
Please do, if you do have any questions, put them in the chat. We'll also have an opportunity at the end if you want to unmute yourself and ask questions too.
So here, this is the Florida Literacy Coalition website. If you type in, generally, if you type into Google Family Literacy or Florida Literacy Coalition and then type in health literacy, it should come up as one of the first hits for you. It's also, if you navigate to our website, you can get to this page. So again, we have the links for the guidelines, the actual application, the checklist, and the FAQ. In the application, we provide this template. You don't need to exactly follow this template, although we do ask that you have these components in your application. So a bit of a project abstract and summary, a blurb about your organization and accomplishments, objectives. Again, it's important to note that for the objectives, they should be in clear, measurable terms. So we give you some examples of that. Your project description, a little information if you are a returning grantee, if you can just include some of the outcomes and successes from your previous project. And the second part is about your budget. Again, we provide you with this template. You don't need to exactly use our template that we provide, but we would like to see these areas covered in your budget. And then if you have any supporting documents that you want to include, well, we do require you to include your current operating budget, and then if you are a nonprofit, a copy of your tax exemption. And then if you have any other supporting materials, maybe letters of support, newspaper articles, flyers from different activities that you do, all of that is welcome. We ask that you limit those supporting documents to just 2 pages. And then let me take you over to once your application is complete, you'll submit it through our JOT form. form. So again, this just has some basic information about your organization. And then you'll see here at the bottom that you can upload your narrative and budget as one document together. This would be the operating budget and then any of these supporting materials. And that will all be submitted through JotForm. If you've done one of our grants before, it's a very similar process for all of them. So there's no surprises there if you've done this process before. And then once this webinar is complete, we'll also be putting a link here on this landing page for this webinar. So if you have any questions, of course, you can contact us or you can refer back to this webinar. And there's also, again, lots of information in the guidelines, the checklist, the FAQ, if any questions arise while you're in the process. And Greg, will you be able to share again
Sure.
this?
Bring it back up. Do you want me to move on to the next slide?
Yes, so that is the application in JotForm. And again, these are all of the elements that we ask you to include. Again, we have that template provided that has all of these sections. But if if you want to do it in a little bit different order or you have your own template that you usually use, we just ask that you cover these main topics. Another one to mention that is important is the timeline. Again, just like with the clear and measurable objectives, it's always nice to see sort of a clear timeline, obviously with the understanding that timelines can change as projects unfold, but it definitely helps our selection committee make their selections if there's kind of a clear timeline moving
Oh,
forward.
that is it?
Yeah,
Okay.
I was looking for this.
There we go.
Okay. Go ahead to the next slide. And again, here is the budget template. We provide this one for you to use. You don't have to use this one, but we do ask that you include these main areas in your budget proposal.
And we do one little tip on budget. We have a review committee, independent review committee that looks at these and makes the selection. One issue that comes up from time to time is that seems to be kind of a disconnect between the budget and the program. So you should have a budget that pretty clearly reflects what you're proposing in the proposal. That might seem kind of common sense, but we have received quite a few over the years proposals where there's elements in there that in the budget that kind of really raise some questions. So it doesn't have to be super detailed, but detailed enough so that you're kind of articulating what you're spending or what you anticipate you'll be spending, and that's relevant to the project itself. This in-kind piece is an optional, but it's always nice if you do have some in-kind to be able to show that too. If you have some volunteers or building space or other things that are donated to support the project, it'll be useful to add that in. That always strengthens the proposal.
And this is, again, what I showed you before on the JotForm application. So you'll fill out this top portion as some basic information about your organization. And then you'll attach your proposal narrative and budget as one PDF document in the appropriate space, and then any of your supporting documents also as PDF.
In this 5-page limit, please kind of make note of that. If the grant, if the applications are longer than that, sometimes they're and they're not going to be probably considered if they're certainly if they're considerably longer. So if you can keep within that 5 pages, and I would also advise to, follow the format in the guidelines. It's much easier for the grant review committee to look and make sure that everything's covered. If you're following that format and you have sort of appropriate headings in each of the categories rather than just sort of, a larger sort of narrative type thing where you have to kind of go in and pick out whether things are in there, that becomes, uh, you know, that's difficult for the grant committee to do that. So easier in more sort of straightforward you can be. You don't have to get into a huge amount of detail around, um, some of the things like project-based learning, because the project-based learning uh, is often I think really should be done in partnership with students and to select a project that makes sense for them to be able to work on. So you could maybe, just reference that. You're going to be engaging your students. If you have a few ideas of maybe what you'll be, maybe what you'll be doing, that's fine to include that. The objectives, I think you don't need to get really detailed in terms of, well, some detail there is good, but you don't need to elaborate in great length because the objectives in terms of sort of the assessment side of it, are sort of built into the project with regard to pre and post health literacy assessments and surveys that students do. But if you do have other areas you're going to be touching on in terms of sort of measuring your success, certainly include those as well.
And as Greg mentioned, there are a few reporting requirements. So we do have the pre and post student assessments. Those are available also on the website. We have a separate student survey about, their experience of the program, also a teacher survey. So whoever in your organization is administering the content to the students. And then we also ask you for a brief mid-year report that's a little more informal, just to kind of see how your projects are progressing, if there's anything we can do on our end to support you moving forward, how things are going, and then a more formal end-of-year report that we share with the Florida Blue Foundation as well. And
Okay. That brings us to the end here in terms of we can open it up for questions. Thank you, Dana. And what I'd like to do is ask maybe a few of our folks who have had grants if they'd be willing to say a few words about their experience. So can I pick on you first, Kathy? Would you mind sharing? Because you've been doing this for a while in DeSoto.
Yes, no, and no, I never mind talking about the great things that have come out of this initiative. We have been a part of this project initiative for several years and feel blessed to have worked with Florida Literacy and Florida Blue. In regard to the projects that our students have done, we have ranged from small gardens, which have been a huge success. I should probably mention first, we're a family literacy organization. So we have pre-K kids at school with their parents. So we've done a garden, we've done a health fair where we got our local health department involved. Huge success because we invited all of the students throughout our campus to attend. We have done shopping in regard to looking for comparing healthy foods to not so healthy foods, where we've gone to Publix and kind of done a scavenger hunt to, pick out the healthy stuff. Then one year we actually purchased the items, the healthy food items for the students, brought them back to the school. The students took them home with them. And then we had a really nice luncheon the next day. Of course, when you have food, that's always a hit. We're fortunate we have an LPN program on our campus. So our vocational students, our nursing students team up with our family literacy adults as well as the little people. And we do mock doctor visits just to give our students an opportunity to practice their English or maybe feel more comfortable when they actually go to a doctor's office. So the sky is the limit in regards to the project-based learning activities. And this is a great opportunity for all adult general ed programs and community-based organizations throughout the state.
Great. Thank you, Kathy. Appreciate that. Any other volunteers?
Yes, I'd like to volunteer. I'd like to show my appreciation also to Florida Literacy Coalition and Florida Blue. We have been recipients, fortunately, for many, many years also. Learn to Read St. Johns County, Joe Sinney. And I think I just recently sent to Greg our CPR class, which was accompanied by Staying Alive music from the Bee Gees, and that was a big success. Lots of views on Instagram, but that's indicative of the type of programs that we have. And much like Kathy said, we've been able to have, I've had a podiatrist this past grant cycle, we've had a podiatrist, licensed practicing nurse. Wildflower Healthcare Clinic is for people without health insurance and without Medicaid. And we've had a Flagler College student who's in sports medicine dealing with fitness and nutrition. So thank you, FLC. Thank you, Florida Blue, for giving us the opportunity to really make a difference with a lot of our students and their lives. Our program here in our Learn to Read office is mainly English for speakers of other languages, adults, but we have partnered with Putnam County Schools to do the migrant children and their families in Palatka, which is a more rural, migrant-oriented area. And that's made a gigantic difference for them. So we've combined the family literacy with the health literacy. But thank you very much.
Okay, well, thank you, Joe. Anyone else?
I could do a quick shout out. This is Christine Briggs with Collier Adult Ed.
Hi, Christine.
Hello, everybody. I want to say the same thing. I feel like this project is now my baby. This is our 7th year, or was our 7th year receiving this grant initiative. And every year just keeps getting better and better. And I'm so excited. I just finished writing it for this one. It just has to get approved first with our district before I send it your way. But the students, if you could just see the students light up with the things that we teach them, or the projects. Our most recent was we focused on dental awareness. So we had Tobacco-Free Collier come in to talk about how gross it is basically to smoke, vape, and chew and all that. And the students got packages with spin brushes, mouthwash, floss, travel kits, books about dental health, and they just get so excited. So it's so nice that we get to receive these funds and service over 100 students. And it's just great seeing their smiles, and we know that they're learning and enjoying. And without this, we would not have that.
Well, thank you, Christine. And oral health is really important. Absolutely. There's a lot of times that's not covered by insurance, so folks really need to be diligent about that. Okay. Does anybody have any questions? You can certainly.
I don't have a question. I'm sorry, Greg. This is Christine again. I actually don't have a question, but a request. And I'm not too sure. This is for moving forward. Every time we give the pre and post test, our students get so discouraged because they're like, what do I get? What do I get? And it doesn't show them their score on how they do. So I'm not too sure if there's a platform that we could put it in. Like, I was tempted to just copy the questions and put it into a Canvas quiz because we use Canvas, but the students get so discouraged and I feel so bad. I'm like, I'm sorry, just thanks for taking it.
So having a score, it might be a little harder to kind of have a system that's going to show the pre and post, but you're just saying have the score for that particular test, right?
Right. Yeah. Like if it's like 5 out of 10 for the pre-test, and then they're like, oh, yeah, I got 8 out of 10.
Oh, right. Okay. Yeah, we could probably do that. Yeah, I'll look into that. Yeah.
Okay. Well, thank you.
Okay. Any other questions on the application or otherwise?
Hi, Greg. Can you hear me, everyone?
Yeah.
Yeah.
Go ahead.
Hi, everyone. This is Humberto from Miami-Dade College. And, well, to be honest, I have been, involved with this opportunity for a while, and I am very happy, very, very happy of what is happening in our college, in our campus, specifically Hialeah campus. Recently, we start receiving much more students from Solidarity Without Borders. Solidarity Without Borders is a nonprofit organization that they have been receiving many healthcare professionals from different countries, mostly from Latin American countries. These students are in our ESOL classes. So we have been so blessed with those students because they are very familiar with the content, with the resources that Florida Blue has been providing for our classes, for these specifically projects. So they are being very helpful for the presentations. These students have been preparing throughout the semesters and presenting very high-level professional presentations addressing different topics. Specifically we have been emphasizing how to get in the workforce, in the healthcare workforce in the United States. And because even though they are professionals from their own countries, they have to, update themselves in the industry here in the U.S. But Florida Blue has been, providing information about the healthcare insurance, and many students of us have been receiving those benefits as well with discounts. And also we put this in the study packs at the end of the semesters. We provide the study packs to the students with a grant inside the Florida Blue bags and distribute them to the students. So at this point, I think that we see, and in the present, we see, great motivation, and we are looking for the fruit, the result, the outcomes in the near future when these students finally finish the English classes, and they will be able to fully engage, in the workforce, the healthcare workforce. So
Right.
Thank you so much.
Thank you, Humberto.
Thank you.
And Miami-Dade's done some really impressive work when it comes to that career piece, integrating this health literacy project
Yes.
With IET programs to help people to become CNAs and other healthcare professionals. So keep up the good work on that. And there's a lot of opportunity for that here, that this can be a really good feeder. As people learn about health, they can also learn about health careers. So, and if you have opportunities like you do at Miami-Dade to really actually have them work on that right there at the university as they're learning. So that's great. Okay, very good. Well, I don't see any other questions in the chat. Last opportunity if anybody has anything that they want to unmute themselves. Okay. Well, then, thank you all again for joining us. We do hope that you'll consider applying this year. Again, March 20th is the deadline. And if you have any other questions, feel free to contact us. Take care, everybody. Have a good afternoon.